Sequence in the management of chronic sinus disease. Once you have diagnosed chronic maxillary sinus disease based on clinical examination, including elicitation of tenderness in the canine fossa and plain X-ray Waters view that shows haziness in the maxillary sinus, the sequence include number 1, proof puncture. This is done using the Tilly-Litchfield trocar and cannula inserted into the inferior meatus half an inch behind the anterior end of the inferior turbinate, where the inferior turbinate curves backwards a point called the genu, where the medial wall is thin. The maxillary antrum is punctured, and after that, gaining entrance, the trocar is removed, the cannula is attached to a syringe, and then the maxillary content is aspirated, proving thereby that the maxillary sinus is infected. The aspirate is sent for culture sensitivity and a suitable antibiotic is instituted. If the patient continues to have disease, then the antral contents are flushed out by performing antral lavage, wherein having done a proof puncture, the trocar is removed, the cannula is attached to a Higginson syringe, the other end of it is in a bowl of sterile water, and compressing the bulb, the antral contents are flushed out. 3. If the antrum continues to be diseased, then the antral drainage is facilitated by creating a permanent drainage window in the inferior meatus using the Tilly's antral harpoon and the Tilly's rosette-shaped antral burr. Once this opening is made, it was presumed earlier that the discharge will drain by gravity via the opening made. If then the antrum still is diseased, then the antral contents are completely cured out by performing an operation called Caldwell-Luck, wherein a transverse incision is made across the canine fossa after elevation of the skin soft tissue periosteum by retracting the upper lip, making an incision in the periosteum across the antrum, and the anterior wall is gouged out, creating a round opening through which the antral contents are curated out, described by George Caldwell and Henry Luck, called the Caldwell-Luck operation. Today we know that the antrum does not drain by drainage via gravity, but that it drains via mucociliary clearance into the natural ostium located in the middle meatus, and therefore this is facilitated by performing a middle meatal antrostomy using an endoscope after excision of the uncinate process, that is an uncinectomy. The natural ostium is widened by performing a middle meatal antrotomy. Since this is done by an endoscope and since the antrum reverts to its functional state, this process is called functional endoscopic sinus surgery or middle meatal antrotomy. This, therefore, is a sequence of operative surgical procedure to be highlighted in the discussion of management of chronic maxillary sinus disease.